Hi all, thank you for joining us in this fifth, assurance talk session. So today it's exclusively only about COVID and the latest, Omicron variant that has hit us. And we have a doctor who has been dealing with COVID from 2 years, and she is gonna answer all your questions related to that. So keep it for COVID and care. Ask anything about Omicron, and we also have our CEO and founder Manish Ranjan here. So you can ask him also anything about how digital health is going to help you recover during this tough times. So we doctor. So anyone who has questions can start writing comments in this session in this thing, and we also have some questions through our registration form. So I'm gonna start first because I'm very curious to know as to what is this Omicron thing? Like, are the same precautions to be followed as to how COVID, like with what happened 2 years ago with COVID, with the masking and everything, and how serious is it?
Okay. Hello, everybody. I'm Dr. Harshitha. So thank you, Aleem and Assurance team for having me here to answer all the queries regarding COVID, especially the Omicron variant. There's a lot of information out there. And because of so much information, that's creating a lot more confusion out there. So here I am to share the right information with you all and to answer any of the questions you would have regarding COVID. So coming to your first question, Aline, that what exactly is this Omicron variant of coronavirus? So virus actually keeps mutating over a period of time. So as it keeps mutating, this is right now the variant which is known as Omicron. Last year, it was the Delta variant, which was predominant. This year, it's Omicron. So the difference in Omicron variant is that the Omicron is affecting the upper respiratory tract of us. So usually the Delta affected the lower respiratory tract. When I say lower, it directly affected the lungs. So we saw a lot of pneumonia cases, which led to ICU admission last year. But this year, what's happening is it's affecting only the upper respiratory tract, the nose, the throat. That is what is getting affected. That's why we're seeing a lot of flu-like symptoms like cough, headache. Headache is basically like sinus kind of pain around your nose, around your eyes, a lot of sore throat. Because of that, we're seeing a lot of cough as well. So these are the typical symptoms of the Omicron variant of coronavirus. So that is the reason it is said to be mild, because it's only affecting the upper respiratory tract, and like any other cold and flu, it subsides on its own in like a matter of a week. But it's the disadvantage is it's highly very infectious. So if one person has the virus and the other person is in the same room and the distance is say less than our 6 meters standard distance, and both of them are not wearing masks, it would take just less than 5 minutes to transmit the virus from one to another. So that's why it's highly infectious, and that's why we're seeing a lot of people getting infected with the Omicron variant of coronavirus.
Okay, based on this answer of yours, we have a question come in. Since you are saying describing the symptoms to be like flu, so how serious can it be? Because typically flu isn't that serious. People don't consider cold and flu to be serious. So how serious is this, even though it attacks only the upper respiratory tract?
Okay, when I say compared to Delta, this one is the less serious variant. Okay, so the symptoms are flu-like for majority of them. Only few of them are landing into any kind of complication where it's actually even affecting their lungs. Okay, but what's actually happening is that in flu, if you do not take symptomatic treatment also, like you don't address your cold, you don't address your fever, it will subside on its own in matter of 7 to 10 days. But in Omicron variant, it's important that you treat your symptoms as soon as it begins. Because if you do not treat those symptoms as soon as it begins, the recovery period is going to be longer. And we still don't have much data to know what is the long-term side effect of the Omicron variant. So that's why it's very important that we shorten the recovery period. Why do I say that the recovery period will become long? Is like basically when you have fever, it's then understanding that your body is basically fighting whatever has come into the body, which is not its own. Basically, whatever foreign element has come into the body, your body is fighting against it. So right now here, the virus is a foreign for the body. So when it's fighting against it, that is when fever shows up. And to fight any battle, we would need a lot of weapons. So your body would be using a lot of those weapons, which are in terms of cells, which have been used. So if you leave that fever unaddressed for a long term, what happens is all of these weapons will reduce in your body. So that is why the recovery period will take longer. But if you start off the symptomatic treatment, actually, I'm not a person who likes symptomatic treatment, but in this case, symptomatic treatment is very important, because when you're giving that symptomatic treatment, the tablets are addressing the fever as such. So that's why your body has a lot of energy to make sure that it can fight the battle long term. So that's why fever and tiredness are something which comes with this virus as well. So that is one difference. Whereas in flu, you would not see much of tiredness, but here you would see a lot of tiredness as well.
Okay, we have another question from Satya based on this answer again. He's asking if the seasonal influenza vaccine that is available, people take yearly vaccination, influenza shots. So does that work against Omicron? Will it work, or you have to take the, Covaxin and COVID vaccine itself?
So influenza vaccine, like it said, it is for the flu. So it will work for the flu. It will not work for coronavirus. Each virus will have its own vaccine. Like chickenpox is also a viral disease. That vaccine cannot work for influenza. So likewise, the COVID vaccine, which is Covishield, Covaxin, which are available, that is what is going to protect you from getting the infection. And many would even have this question that even though I'm vaccinated, I still got affected with Omicron. So what's the vaccine basically going to do is it's going to make sure that you have enough antibodies in your blood. And when a virus comes into your blood, vaccine cannot stop a virus entering your blood. The virus will come into the blood. It just makes sure that your body is prepared to fight the virus. So that is also the reason why the Omicron variant is milder compared to Delta variant, because we've seen that many of them are already vaccinated or they've already got infected from the previous two variants, due to which there is a lot of antibodies already developed in their blood. And when there are antibodies already, so antibody, like I said, is a weapon. It will fight against the incoming virus. And that is why this is the milder one. So to answer in simple, you need to take the COVID, the coronavirus, either the Covishield or the Covaxin, to prevent basically yourself getting from COVID, so that you're immune even if you get it.
And we have another question coming is, how okay, you have already answered. See, the doctor already answered the question that, Omicron Omicron is highly contagious, but the symptoms are controllable. So I hope this answers your question that, how contagious Omicron is compared to the Delta variant. Now, another question that has come up is, how long do I isolate myself if I have the Omicron variant? So is there any antigen test that can be done at home that tells if you're affected by Omicron, or, you even if you have the COVID symptoms, it is the Omicron symptoms itself? How do you differentiate?
Okay. So this is basically the question going towards how do we really manage if we've gotten affected by COVID. So let me cover that in different steps. So firstly, you would notice any of those initial symptoms, like you would have got either fever, cold, cough. Any of those symptoms is what you'll initially notice, which will make you suspect that I might be affected by the virus. So immediately when you notice these symptoms, please isolate yourself, okay? Stay at your house and then reach out to your doctor. Even though this is a very symptomatic treatment, you can take over-the-counter pills, it's still advisable that you reach out to your doctor so that you know what is the right amount of dose needs to be taken, and also what needs to be monitored. Because unlike flu, here you really have to monitor your temperature, your SpO2, you need to do a lot of other things like make sure that your fever is not increasing beyond 100 degrees Celsius for 2-3 days. And all of these things only a doctor can advise you. So immediately, right now, so many doctors are available, teleconsultation. I've seen that Assurance team organizes general physician consultation 24/7. So reaching out to a doctor over a video call is not difficult anymore. So it's very easy. So that is what I would suggest, that immediately reach out to the doctor so the doctor can begin with the symptomatic treatment. Along with that, of course, the doctor would suggest to get an RT-PCR test done, which will confirm if you are positive or you are not. Okay, after that is where you'll have to start now staging. If you come into the mild category or moderate category or severe category, usually most of them will fall into the mild category. The severe ones are basically 60 plus, who already have existing diseases like diabetes, hypertension, who are on daily medication for any of these long-term diseases, or whose, like I said, fever is not at all subsiding, or they have their oxygen saturation, which is dipping less than 94. These are the people who fall into severe categories. So only this population is actually required to go to the hospital to really meet the doctor in person, would have to take any extra treatment which requires hospitalization. Otherwise, everybody else is considered as mild. And for mild, what's required is that stay at your home, isolate yourself in the room, and just take the symptomatic treatment, do the steam inhalation, drinking a lot of fluids, all of this which your doctor would be telling you, taking vitamin supplements so that your immunity is boosted. That would be good enough, and that could be really managed at home itself, which will be convenient for the person who's got affected, the family members, and eventually the overall community as well, so that the community is not, because if a lot of them go to the hospital, then eventually who need the treatment at hospital, they will not be able to get it. So that is why that's how it needs to be managed. And after that, it usually takes about 7 days of isolation is what the government has prescribed, that from when your first symptom has come, 7 days you need to be isolated, ensuring that the last 3 days you've not had fever at all. So after that, you can end your isolation. Just you have to continue wearing mask, maintaining social distancing, the normal preventive measures which we do. That much is enough. So 7 days is what is mandated. But suppose at the end of seventh day you have any symptoms, then it's advisable to extend for 3 more days. So
So
that's
does
when you
this
end your
isolation, okay, so does this isolation part stand true to the Omicron variant also?
So right now in India, especially, we are not actually going ahead and doing the gene testing for every RT-PCR positive, because the most popular lab is in Pune, and there are just 2 to 3 labs which actually do the gene testing. So imagine all the India's cases where each state has around like 40,000 on approx going to those 2 3 labs for gene testing. We will not get reports that soon. By the time you get your reports, you would have your isolation would have been done. You would have already recovered. So we are actually not going ahead and doing gene testing for all. So we don't know if it's Omicron variant or Delta variant. But majority of them who are getting right now is the Omicron variant. The ones who have the Delta variant and still have only upper respiratory tract symptoms, please go ahead with this itself. But if you've gotten a Delta variant, supposedly gotten Delta variant, and it's affected your lungs and you've ended up pneumonia and all, then automatically your symptoms will actually be for longer time. In 7 days, your symptoms will not subside. You might have fever, your saturation might dip. So all of those becomes your sign that you reach out to your doctor, and then if required, hospitalization can be done.
So 7 days is the standard isolation period for anything, whether be it Delta or Omicron. Okay. So another question that Srishti has asked, one of our viewers have asked is, when is the right time to get tested? Considering the symptoms are milder and they're different from what the Delta variant had. Right now in this Omicron time, what is the right time to get tested? How many days down the line?
So basically, if there are 2 types of tests, like which you had asked in the beginning, there is RT-PCR test and there's the antigen test. The RT-PCR is one where they take your nasal sample and the report comes after 24 hours. That is which is the most reliable. The rapid test is the antigen test where you get your reports immediately. So basically, I would suggest to get an RT-PCR test itself. And as soon as you get your symptoms, you can book a test. Maybe within a couple of hours, you can get the sample collected and you'll get your report in next 24 hours. So maybe within 36 hours of getting symptoms, you would have your reports. So that would be if you have missed that period, anytime after that is also fine. So RT-PCR is the test I would suggest. For antigen test, even though it's rapid, it really takes little time for your body to show that to be positive. So even though if an antigen test is negative and you still have symptoms, it's not considered that you might not have COVID. It's advisable, even if you've gotten negative, go ahead and do an RT-PCR test. If you've got positive, then it's okay. You can skip the RT-PCR test because RT-PCR will also confirm it again that it is positive. But suppose that has come negative, because it takes your body to develop antigen for some time. Because it's not like the virus is telling your body beforehand that I've already come, get the antigen ready. Once the virus comes into your body starts recognizing that, okay, it does not belong to my body, it is foreign to me. So then it takes a certain period of time and then starts developing weapons accordingly to fight it. So that's why the rapid test takes a little more time. So that's why rapid test can be negative at many times, even though somebody has COVID. So rapid test ideally would not be the best on the first day itself.
Okay. So another question that has come up is, let me just understand the question first.
Sure.
Can you have flu? Can you have flu and coronavirus at the same time?
I think they meant flu and coronavirus at the same time.
Yeah, then can you have flu and coronavirus at the same time? Is it
Yes,
possible?
possible. Two virus can be infecting you at the same time. And if the follow-up question would be that how do I differentiate? For, of course, the coronavirus, it can be identified by RT-PCR, but for flu, we really don't have any test like that which will detect that it will confirm that it is a flu. So that's why you can definitely have both of it together. And that's what I think is mostly actually happening right now also, that most of them who have gotten tested, they're pretty comfortable. Okay, they're like, okay, I am actually COVID positive. But those who have not gotten tested, they're like, okay, it might just be a flu. And a lot of people are ignoring that also. And they're not following the preventive measures. They're stepping out. They're not really wearing mask all the time. And that's where it's actually spreading to a larger number. So that's why more than how do you manage it, because by now everybody knows pretty much few things, that what do I need to really do? I need to really isolate myself. I need to go seek to a doctor, do a teleconsultation, and whatever treatment has been given to me, I need to follow that. So that management part, most of them know and they do it. But preventive part, even though everybody knows it, it's not being followed. So I would really stress upon following the preventive measures. Like if you would have, when this question was actually asked to me last time, that what kind of mask should I wear? So I actually said that do not shell out money on N95 mask. Please wear like even a single layer cotton mask would also be done, because Delta was not highly infectious. It was a very serious virus, but it was not highly infectious. It was not that contagious.
So no, thanks. So before that, doctor, do you want to go ahead and why you really like? I mean, like we always prefer to hear, because the entire solution is meant to ease and support the existing team that's already there. So how can we make them more efficient? How can we cater to more patients? And the basically right sizing, which is in the sense the right doctor and the right nurse is available to the right patient. So I mean, if Omicron or even Delta before, right, the biggest problem was not the disease itself, but the right care could not reach the people at the right time. So that's the biggest goal that we have with a solution that we have, and offering like assurance. So doctor, if you can throw some light on that, that will definitely help.
Yeah, definitely. So basically, I'll share an experience of the users, especially after pandemic. Users are also really scared to go to a doctor and meet in person, go to a hospital like that for even any of those things. And for doctors also, we have to of course treat, but we are also having to maintain certain things like wearing PPE kits most of the time, having like a barrier between during the OPD consultation. So all of those things have actually limited the physical contact, which usually the doctor had to do for the physical examination of a patient. And because of that, teleconsultation has really picked up, and it's become very convenient from both user perspective as well as for doctors as well, because users are able to really reach out to the doctor anytime they need it, and they can reach out to different kind of specialists, and the doctors are able to see the users during a video call, so they can assess that what's the criticality. Do they really need to come to a hospital right now itself? And also a lot of platforms are providing basically the reports in hand. So those, and like assurance, I can see the reports of the user not just during once, but from when the user is on the platform. So I can see the entire history as well. So that is really helping me in taking the decision as well faster. So that really is the key why teleconsultation is really working so much. And along with that, for something like COVID, like you said, that it requires monitoring for 7 to 14 days. And imagining having the patient at hospital bed for 7 to 14 days, our Indian population cannot handle that all in hospital. So mild to moderate cases are where it has to be managed at home, because that's where it's convenient. But when it comes to manage at home, you don't have doctors at home, you don't have all professionals at home. They're like all normal people, and they would be hearing a lot of WhatsApp forward, a lot of news things, and they will not know what to believe. So your platform wherein it can actually connect the doctor and the sisters and the nurses basically with the patients, and the sisters are really monitoring it, taking all the data also digitally, capturing it, And your system, one thing which I really like about your system is that it automatically tells that is this at a high risk once the data is entered, or this is mild. So it alerts all the concerned doctors and this nurses as well. So that really is very helpful for all these people who are being managed at home. That's why we can be relaxed and we can make sure that we're looking at more people like that. So that is the reason, I think, the why the tech is really bridging, and the combination of tech and the professionals at home is really working.
Right. No, definitely. I think the biggest challenge, which the doctors mentioned before, that we don't, why when we are away, how can we be sure that the patients are actually doing okay? And that's where I think all these data that we are able to collect, periodically through the symptoms, I think is making a big difference. So also, I mean, like when the biggest change we see, like when we started off, the whole goal was to solve the problem of non-communicable diseases, but over a period of time we realized that the difference between non-communicable diseases like diabetes, hypertension, and so-called communicable diseases like COVID, or dengue,
Dengue, typhoid.
yeah, etc., is that something that happens in 14 years. Here the effect of that can be seen in 7 days or 10 days. So and that's where the technology can make a huge difference, where you can actually tweak the solution to address a problem for 14 years also, or for 14 days also. So that's where be it the capturing of symptoms, be it the various data points that are coming, and making it meaningful. We always believe that only capturing data is not enough. How do we make sense out of that and give you more insights, both for the doctors and the patients? And that's where basically the impact is coming, and that's what we are trying to show, and basically scale at this point of time. So yeah, so very happy. I think one point that you mentioned is that you can sleep at peace, at ease, and actually that's exactly the very important for, I would say, the why entire organization, even including for me. I mean, before I sleep every night, I see all the patients that we are actually managing, and they are doing okay or not. So be it, or how many people of them are at high risk. So if hundreds of people, patients, if I have to go and see their symptoms every day, is just not possible, right? So I'm able to actually go ahead and see who are the people at high risk, and just focus on them, and making sure that whatever care was required to be done is actually provided or not. So yeah, I mean, very proud of what the team has been able to achieve. It's an excellent combination of technology and human touch. Our health coaches, the doctors, and the wider specialists who are working closely with us is actually making an impact. And I really hope that we can scale it up to not thousands of people but millions of people as we move ahead. So yeah. Okay, so no, thank you, Dr. Harshitha. Over to Alim. If there are any more questions, then otherwise we can.
Yes, thank you, Manish ji. Thank you so much for this great insight, and thank you, Harshita, for actually giving us some, factual information that many people were missing out on, because there is so much going on in the news, and we don't sometimes know what to believe and what to believe. And so even if you believe it, if it is applicable to us or not, that is the most important part. So thank you for clearing out all these doubts, and thank you, Manish ji, for making such an efficient system out there that not just the doctors, but family people members are also going to sleep well. They don't know that we know that you don't run to the emergency station now. We have people who are going to consult us and take care of us at home. So that's super great.
Right, and no, yeah, ultimately our goal is to through doing all this to prevent avoidable hospitalization. So that's what we're all looking towards. It's a lot of making everyone at ease, like you said, with the patients, the doctors, and and their family members. So yeah.
So ending the session on this note, be proactive, everybody. You have to wear your mask. You have to get the sanitization drills going on, because this virus is in the air right now. It's Omicron is highly contagious, and you also have your Assurance by Nano Health platform now. Whatever doubts you have, get online, ask the specialist, and do not go for don't go to the Google doctor. Just go to talk to a real doctor.
Thank you. Thanks everyone for joining in.
Thank
Thank
you.
you.
Really
Thank
hope
you,
that.
Manish. Thank you, Alim. Thank you, Team Assurance.